I am Dr. John Kaiser, and I am a vascular surgeon in the surgical clinic. I grew up in Illinois, went to the University of Illinois, and went to their medical school in Chicago. And after 4 winters in Chicago, I was ready to go south. So I did my internship and residency at Vanderbilt in general surgery, and then a year of vascular training at the Ochsner Clinic in New Orleans. After that, I came back to Nashville to start a practice, and over several years, we congealed multiple practices together to form the surgical clinic. So we started our first small little vein center 12 years ago and now have expanded to 3 locations. It's just for the treatment of vein patients. We're not seeing other types of surgical patients as we are in our other offices. So after doing arterial and venous patients for 27 years, last year I confined my practice to just vein patients. One of the biggest reasons behind that was our ability now to treat deep vein disease. I started the Baptist Wound Center 28 years ago, and at that time we didn't have much to offer people who developed sores on their ankles as a result of chronic vein problems. Well, in the Wound Center, up until the last couple of years, we were able to get most of those to heal, but they very often came back and the people had to wear a long-term compression stocking, which are miserable. There was a review article published 2 years ago that summarized several series over the last several years where people were investigated with a venogram, which is an injection of dye into the deep vein system, to see if there might be a narrowing in the deep veins, and then go on and treat that with balloons and stents. We've always been concerned that that could cause a lot of blood clots and other problems, and in fact their results were very, very good. And so we started pursuing that a little over a year ago. We can now help to open up the veins that may be narrowed and reduce leg swelling, leg pain, and greatly reduce the chance that they'll get into ulcers in the future.